Hello, this is Emily Peters, Care of the Growing Family, Unit 6, Responses to Hospitalization in the Care of Children. Sorry, my slides did not convert over very well. Hopefully you can still read these. So I want you to think about this question. What kind of things would influence how a child responds to hospitalization? So over the last two PowerPoints, we mentioned quite a few things. Why don't you jot down a few things and we can bring it to class to discuss it, and then we'll go into a little bit more detail of some other things as well in this PowerPoint. So for instance, developmental age, their previous experiences, coping skills, what their illness is like and the seriousness of it, support, how about how their parents will respond. Kind of think about those different topics. So stressors. We have separation anxiety. This affects primarily ages 6 to 30 months, so 6 months to 30 months, so that kiddo that's not quite 1 year to that kiddo that's about 1.5 years. We have three major stages. We have the protest stage, which that child reacts aggressively. So this is when they're going to cry and scream and they're very inconsolable. Your despair stage, the crying stops. They're depressed. They're less active. They're uninterested in play or food. They withdraw from others. Then we have the detachment stage. They're in denial. They appear as though they are finally adjusted to the loss. There's results in resignation to the situation, but they're not content. A lot of the times these kids will detach from the parent to escape the emotional pain of desiring their parent's presence. They will respond no differently to their parents than any other person. Okay, so why don't you guys think of some different examples of these, and we'll bring it to class so that you understand them a little bit closer. These are good terms to be aware of. Separation anxiety. A toddler, a preschooler, a school age, and adolescent are all going to deal with these slightly differently. So separation anxiety is if separation is avoided, tremendous capacity to withstand any other stress. So toddler will respond in like temper tantrums, bedwetting, failure to comply with care, acting out. So that toddler that was previously potty trained may revert back to not being potty trained, or that bedwetting. Preschoolers will tolerate brief periods of separation. However, they may refuse to eat. They may have problems sleeping. They may cry quietly or withdraw. They'll refuse to cooperate with their self-care, such as getting dressed, brushing their hair, brushing their teeth, etc. They may also take out this anxiety on their toys by breaking them, or they may hit people, kick people, things like that. The school-age kiddo with separation anxiety, most of their concern is with separation from school and activities, peers, but they'll be concerned about their parents as well. They may need more parental security. So that school-age kiddo who is used to being separated from their parent, if they're having some separation anxiety, then they may want to have their parents with them more. They may be more attached than they have been in the past. Adolescents, their separation is a concern for their peers, not being able to go to the school dance, not being able to see their friends and talk about boys or the latest, video game or basketball game, whatever it may be. They actually will probably more than likely enjoy being away from their parents. So how would we ease the separation anxiety that may occur, especially for children under the age of 5? I want you guys to think about this, and we'll have a discussion about it in class. Same with these. What factors may cause child to feel loss of control while hospitalized? What kind of interventions would you take to decrease the loss of control a child may feel while hospitalized? Break it into different groups of toddler/preschooler, a school age group, and an adolescent group. Kind of write down like what factors may cause that child to feel that loss of control while in the hospital by those three groups. And then let's list a group of interventions. And we'll discuss this as a group in class as well. Think about bodily injury and pain. Greater than 6 months of age, there's an increased response to pain because of a recall and emotional pain reaction that they'll see in their parents. That anticipatory preparation. So break it up. Toddler preschool age group, a school age group, and an adolescent group. And do the same thing. How each of those age groups will respond in anticipate bodily injury and pain, and then what can we do? And we'll discuss this in class as well. Okay. Pre-op planning care for a child. So, what differences might there be when caring for a child and pre-op care to an adult? Would they respond physiologically different than an adult? Think about anesthesia. Children are fearful of masks, so you can use masks that are geared towards children. You could use dolls, a mask that's see-through, one that smells good. They could have smells to them. How would you educate them? What kind of ways could you show them what they're going to be going through? How can we help them post-operatively? Once again, in the adult, just like in the adult, fluids are not allowed until bowel sounds are heard. That deep breathing, but what can we do to help with that? Range of motion and mobility. Injections. We're going to avoid shots as much as possible, so we're going to probably leave that IV in longer. Or do other routes of pain medicine management, such as rectal, versus if we can't have anything orally. How fast should we be walking them? Pain control, and how should we assess that in that pediatric patient versus the adult? We'll talk about a bunch of this stuff in class as well. Think of some examples of ways that you could stimulate that deep breathing, what we do for an adult, and how would you change that for a child? Okay, variations in nursing care. Chapter 10 has a bunch of different things on vital signs, pain assessment, preparation, for procedures, communication, and giving meds. I will bring a few things to class about this as well to kind of show you a few things, but make sure you've read those chapters. And I'm also going to show a few videos on ways to give meds and some medication administration and safety. All right, that's the end.